Alright, in this audio lecture, we're going to be learning about cerebral palsy. This is a continuation of the neural disorders lectures that are preparing. So, cerebral palsy is a disorder that results from damage to the brain. Okay, so, this is generally a condition that affects movement and coordination. It is not progressive, meaning it doesn't continue worsening, but it becomes worse pretty early, or pretty bad pretty early. Okay, it appears very early in childhood or during infancy. So generally, the brain damage is caused during childbirth, and then also maternal conditions can affect this condition as well. So, if we have cerebellar damage, meaning there's damage to the cerebellum, that damage is generally prenatal, so it's occurring while the child is in the womb or very young, less than 3 years of age. Okay. So this isn't always isolated to muscle coordination or muscle movements. This can also affect cognition. Okay. But most of the time, we can see this disorder display with a normal or a functioning level of cognitive abilities. But it affects cognition because anything that affects the brain, depending on how much of the brain or what part of the brain you can impact, can incorporate other effects. Okay, so this disorder is more common in males, African Americans, and persons of lower socioeconomic status. And generally, we see these disorders because of poor diet, poor maternal diet, obesity, diabetes, and prevalence of smoking. And so we see a number of conditions of socioeconomic status that can come into play here. So cerebral palsy is the leading childhood disorder. It occurs in about three to four out of every 1,000 live births, and so we see that this condition, while it is a non-curable, treatment can help, but it is very expensive treatment. And so your textbook gives a couple numbers. I don't know exactly how to interpret those numbers, but it ranges between $920,000 for treatment over a lifespan to $11.5 billion, representing two different numbers. I could see the actual cost being much higher than 920,000, but I have a hard time believing 11.5 billion dollars for cost. But what we see here is that we have a condition that is incurable, that affects motor function and can impact other things as well. And so treatments are going to be more managerial. They're going to be more management rather than actual curative. So we have a number of really risk factors or contributing factors for the development of cerebral palsy, including prematurity. So if the child is born before its due date, low birth weight, breech births. So this is an image of a breech birth in which they are presenting feet first rather than head first for delivery. Multiple fetuses, so twins, triplets, quadruples. That it increases the risk. Developmental hypoxia. Anytime you have hypoxia in fetal development, the baby is not getting enough oxygen, and so this is going to cause nervous disorders, really impairment of the function, because now they don't have the oxygen to produce the ATP. Okay. Now, maternal or fetal hypoglycemia. So this is the low blood sugar for the mom or the baby, and so we can see that hypoglycemia can be a factor coming into play here. We have a number of other factors, including cerebral hemorrhage, neurologic infections, and head injury. Right. So here we have an example of a suction cup being put on a baby's head, helping in delivery, and so this is helping him get into the birth canal. Well, this can apply pressure to the underlying brain tissue, as no surprise, causing head injury. We see that maternal infections during pregnancy, especially rubella. Rubella is the particular one that the textbook points out, infections, and so if you get your MMR shot and you're vaccinated for rubella, then that is easy to avoid. Okay. Maternal exposure to toxins, and so really this would be an environmental effect. So the mercury levels, so they tell women to avoid predatory fish, because like tuna or swordfish or any of these big fish that feed on smaller fish, because mercury accumulates in animals as you move up. Okay, and the concentration builds up in tissues, and then severe jaundice, right? So the inability to break down red blood cells, okay, can lead to this yellowish appearance, which can cause brain damage that can potentially result in cerebral palsy. So we see that the manifestations of cerebral palsy include the following, but they might not be present at birth, right? They might take some time to develop, and so they might not be too evident at birth that your child has cerebral palsy. They vary in severity, and so really much like many of the disorders that we've talked about some variability in how they present themselves, and that is no different here. If we remember back to that first slide where I showed the different variations of cerebral palsy and how it can affect it. It can affect one side of the body really, it can affect that one side of the body differently, or it can affect the entire body or one region of the body. Really, it's just dependent on the extent of the brain damage. We also see persistence of early reflexes, like the rooting reflex. So an early reflex is something that is referring to the reflex is present during for infants, right? So the ability to grasp a finger, the rooting, the suckling reflex, the plantar reflex are all early reflexes. And so another manifestation that kind of goes along with this persistence of early reflexes is developmental delays. So the child has a difficult time learning new things. Ataxia is going to be impaired balance that resembles that of an intoxicated person. Spasticity is going to be your muscles and your reflexes might be kind of spastic, meaning they're irregular and they spasm. Hyperreflexia, which would mean that you have reflexes that are exaggerated, right? So it's going to more easily occur, or it'll occur randomly. Asymmetrical gait talks about your walking pattern, meaning your walking pattern is not going to be consistent right now. So when you walk, normally it's a pretty smooth motion. Well, individuals with cerebral palsy often have this pretty noticeable difference in gait, and their walking kind of differs. Okay. So another manifestation is that the individual can drag a foot when they walk, and that kind of goes with the asymmetrical gait. Some other manifestations include excessive drooling because of incomplete lip closure, difficulty swallowing because of the skeletal muscles that control swallowing, reflex, impaired suckling. This would kind of go in with impaired really drooling or swallowing. You're going to have impaired skeletal muscles that control these functions. Along with this, you're going to have speech issues or facial grimaces. So facial grimaces is the grimace, right? So you display this because now you have this spastic kind of capacity of your muscle. So your muscles spasm, and they can create this appearance of a facial grimace. Tremors are going to be really involuntary muscle contractions, probably not too much to generate too much of a disturbance early, but as they develop, tremors can get worse and worse and worse. Difficulty with precise motor patterns. So fine motor control is going to be affected for this cerebral palsy. So but we will see a variation. So we might see some people that have fine motor control, and then other people who lack the fine motor control. Complications of cerebral palsy. Obviously, individuals are going to have balance and coordination issues that could worsen. Okay. Contractures are hardening of muscles, so it's going to be a hardening of muscle that can lead to a rigidity of muscles and then the joints. Okay. And so what this is the muscles are permanently contracted and they're stuck in that state. Okay. We can see malnutrition can be worsened by cerebral palsy, and communication issues and speech delays can obviously accompany cerebral palsy. Now, some additional complications can include learning or cognitive disorders depending on the severity, seizures can occur, visual issues. So likely the skeletal muscles that control eye movements, and then also the development of the optic pathway. Urinary incontinence, again, because you have really modified skeletal muscle function, and so now your skeletal muscle may not work correctly in response to this, and chronic pain. So how are we going to diagnose cerebral palsy? We're going to do a history and physical examination, okay, looking for any of these manifestations that would give us an idea, and we're going to know fairly early in life if cerebral palsy is present or not. We're going to do head imaging, so specifically looking for the CT scan or an MRI. Okay, and this is going to allow us to visualize any kind of damage to the brain. Diagnostic testing, since this is impacting nervous tissue, we're going to expect there might be changes in the electrical activity occurring in the brain, so that's an electroencephalogram, or EEG for short. We might see abnormal hearing patterns or vision patterns, right? So just like what we've seen previously is if you have neural disorders that are affecting the brain, they are likely impacting other components as well. So I put this term in there, managed, because I think we would manage cerebral palsy rather than treat cerebral palsy. We're going to treat the symptoms and we're going to manage the symptoms, but we're not going to cure the disorder, right? So it's a permanent disorder. There is no cure for it. The only thing that you can do is manage the symptoms, right? And so we can manage these symptoms in multiple aspects. So first and foremost, we could use pharmacology, right? So pharmacology, we would use muscle relaxants that are going to, so for the spastic muscles, or the muscles that are contracting, we could use these muscle relaxants to kind of dampen the innervation that they're getting. On the same note, we could use Botox injections, right, to inject into spastic muscles to kind of, so Botox paralyzes things, right? And so if we paralyze them, then eventually the Botox wears off and you have to get another injection, but this can be a temporary relief. Pain management, so analgesics to help with any kind of pain, anti-seizure medications to prevent seizures. Therapy, we're going to try to prepare the person to have as normal of a life as possible, and so using physical therapy, we're going to probably work on grasping things, handling things, walking, okay, reusing your braces properly, which we'll get into that on the next slide. And then you try to use professional skills, right? So occupational therapy, speech therapy would help make sure that the person can communicate and can perform a job. In the same note, we're also going to provide supportive therapy to the family and the individual themselves, because this is hard on everybody involved. Now, how are we actually going to intervene? We might use braces or orthotics to help with correct walking. We might use ambulation devices. So ambulation device is something that helps somebody walk. So crutches would be an example of an ambulation device, or a walker. And then we might have a surgery to relieve contractures, right? Or to sever nerves of spastic muscles so that it's not continually receiving that signal. If you cut the nerve, now the nerve is going to undergo paralysis, but that is better than the spastic nerve and the pain that is associated with that spastic nerve. And we're also going to provide an individualized education program where we're going to try to approach the individual as much as possible. Now, we might also try to. So one of the problems with this is bowel disorders, right, and constipation specifically. And so we might try to prevent that constipation by delivering a high fiber diet, ensuring adequate water intake to make sure that the feces doesn't get too hard in the process. We might use glasses to help with vision, and then hearing aids to help with hearing. So remember that during the diagnostic testing, we tested hearing and we tested vision. And so if we detect any kind of deficiencies in those areas, we're really going to try to get it corrected as quickly as possible. All right, that is the end of the cerebral palsy lecture.